Hi, this is Dr. Dan Ratner, and today I am joined by Dr. Roy Seidenberg. He's a board-certified dermatologist, assisting clinical professor at NYU School of Medicine, also a consulting physician at NYU VA Hospital and in private practice. I don't know how he has time to do all of this, but I guess I can relate. In any case, I'm looking forward to talking with him. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I'll get back to you personally. Roy, it is a pleasure to have you on Crushing Doubt. I have kind of been collecting the best of the TMS mind-body world, and you're long overdue because I've heard lots of great things about you from multiple sources. So thank you for taking the time to be on here.
My pleasure to be here, Dan. Thanks for having me.
Oh, it's fantastic. And, one of the reasons that I wanted to bring you on is that you have a specialty. It's, there's so many of the mind-body practitioners who we work with mind-body, stuff in general, but you're a dermatologist. So I wanted to hear what that is like. But before we get there, I always start with the initial story of how did you get into this? What happened for you?
Well, I did a whole lot of training after med school and two residencies, and I learned zero about psychosomatic medicine. And only after I graduated my residency and I started practicing, you've heard this story before, I got one case of back pain, and it just got worse and worse and worse. Of course, there were other, little minor medical problems along the way. And my sister-in-law, who had told me about Dr. Sarno. And so, of course, when I heard this, I was really thought she was an idiot. So I blew that off because I didn't learn this in medical school. So I had a long year of suffering, and I looked great though because I had lost weight. I, was doing physical therapy 3 times a week, going to the gym the other 4 days a week. So I was looking the best I've ever looked in my adult life, and I was in incredible pain. Had my epidurals. People told me I should have surgery. And then about a year later, again, the same sister-in-law told me about Sarno. And then since I knew something else had to be going on because I was being such a good patient, it clicked. And at that point, I didn't even need to see Sarno, but of course he was around the corner from where I worked. I saw Sarno. I was actually the visit was almost a little anticlimactic because she had told me when she walked out of Sarno, her visit, she said, "Oh, Sarno told me what my problem was," and then she got better really quickly, and I didn't have that moment. But about 3 months later, I realized that I can't believe I still have pain. And then I realized all the things that my life was actually 80% better. I didn't even realize it. And about 3 to 4 months after Sarno, I took a 14-hour plane ride to New Zealand where I went bungee jumping 4 times, hang gliding and skydiving, and things that you wouldn't do if you really thought that your pain was structural. I still had some pain, but I knew it wasn't structural, and I was able to do all those things, and I never looked back.
That's
and I became a part of the cult. So.
Right. It's funny you say that because I do often say to people, listen, I know it sounds culty at times, but it's all based on science and logic, and it also works. So we've got all of that going for us. But what I'm hearing is you got a major reduction in fear that there was something wrong, and so you could still have pain, but go ahead and go do your normal things. That's an important part of the story.
Yeah,
Go ahead.
No, I learned that it wasn't structural. I look back, I saw my other medical problems went away. I had a classic Sarno symptom substitution or the symptom imperative, where when my back pain started, my terrible seasonal allergies completely went away. And I only realized that in retrospect. And looking back, some other mild medical problems along the way were probably stress-induced as well.
That's also important, though, to say. A lot of times when people do get better, they get better from multiple things. With my brother, he had back pain after I had already cured mine, and he finally came around and said, okay, tell me about this. We were on vacation. We spent about 2 weeks together, and I talked to him every day about this, and he started getting better. And 2 weeks later, he wasn't lactose intolerant, which I didn't even say anything to him about. He just started thinking these things through, and he was like, oh, wow. And it really opens doors for people. But I just want to make sure that I followed your timeline so that I understand what happened for you. You were already in dermatology when you developed the back pain?
Mm-hmm.
Okay. Because one of the things I wondered about is, okay, here you are, you're a mind body practitioner, but you specialize in dermatology. I was wondering how that happened. And what I can hear is you went into dermatology anyway, and then you incorporated this stuff.
Exactly. Yeah.
What do you now make of when you look back on med school? What do you make of the fact that they weren't teaching that at all? Are they teaching that at all now? I
I'm
have no
sure
idea.
there are pockets here and there, just as there are residency programs here and there that will incorporate a psychologist into a dermatology clinic or sure other specialties. Psychiatry was 3 months in your third year med school. It was very inpatient based. It didn't really touch on neuroses as much as psychoses, and I know that in this country where we have such a for-profit healthcare system, that it's going to be less believed, and it's certainly believed in way more than Europe and South America than this country, and that's a lot of that is based on the healthcare system and how it's set up.
Really good point, actually, and that's something I want to talk more about just in general on this podcast. Is what is healthcare doing? We have a framework that sets things up in a way that doesn't reward doctors for taking the time to be with people or for doing these procedures, or not even procedures that don't
Well,
pay.
it pays for doing procedures, but it
Exactly.
doesn't pay to
Right.
talk to a patient.
Right. They don't
And
consider that a procedure.
right. And I mean, if I would buy every first year medical student The Divided Mind, Sarno's most recent book, if I could, incorporate it into their classroom studies.
I
And
couldn't agree more. I mean, wouldn't that be so great if that were actually in med schools?
yeah, ideally, of course, he should have been the Surgeon General, and that would have changed healthcare. But the book is in every exam room I have, and it's something that I'll bring up to about 5, 7 patients a day. It's the only book in my exam room, so there's no magazines anymore. So if they're going to pick up something other than their phone, it's going to be Sarno's book or some other related textbook.
That's smart. You don't give them an option. It's either Sarno or you sit there.
There you go. Let them meditate. That will help them as well.
So, how many of your patients come to you that are seeking out help with a mind body issue in the first place versus they come to you and you just happen to have this area of expertise, which is extremely helpful?
Those that seek me out, knowing that I'm part of this world, are very few. They may come from the TMS wiki, or they may come mostly will come from Ira Rashbaum, of course, who is one of Sarno's main proteges. Now, but then I'll have the French woman who walks in and says, "Oh, my eczema is terrible because of the stress I've been having lately." So she
Right.
knows.
Some people do
But
know.
again,
Yep.
yes, the South American who says, "Oh, my psychologist and I were talking about, and my stress was causing my hair loss or something." So sometimes they come from out of this country knowing more.
So I do want to talk more about that because you're bringing that to the surface in a really important way. It does sound like you have very much the experience that people in America are much less likely to either know about this or be open to it. Maybe it's both. Which do you find is true, actually? Is it more that they don't know about it or more that they're not open to it?
I would really say they don't know about it, because you have to pick and choose your patient. But the way I can bring this up is that on my intake form, where patients fill out their information, I just have a question, and it says, "Do you believe the mind and body are connected, and the mind can initiate physical disease?" Like a question like that, and if not, you're interested in learning about this. And a couple yes/no questions will just immediately screen me or screen the patient into, if they're open to this or not. And a lot of people will check off yes or maybe. And then also, there are the established physical medical problems that we all mostly consider psychosomatic. And on the list of medical problems to check off I have all those in one column. So I could, from 4 feet away, I could see how many things were circled in that right-hand column and know, okay, they've got multiple TMS, what I believe are multiple TMS issues or equivalents. And so I kind of almost have a little TMS gauge on that patient.
That's a great idea. Obviously, you thought that through and steered people in that direction for a reason, and it must make it easier because then when you're talking to somebody, you're not trying to figure out as much where you might stand in that. You kind of have some idea about it. So, can you talk a little bit about then when you're consulting with people? Well, let's first talk about this. What types of issues, dermatologically, tend to be more mind-body related?
Eczema, I think, is a big one. I think acne, and again, when we talk about a condition, it's not that every acne patient is TMS.
Right.
It's, there are some patients where the acne is going to be 90% TMS, and some patients where it's going to be 10% TMS. And the patient has polycystic ovary syndrome, and that's I don't think that's TMS. So it varies, but acne, people love to talk about during this pandemic mastne, and I think that's more a false trigger, as Sarno would say. I think that's more psychosomatic than actual physiologic, because there's been millions of doctors and nurses wearing masks for a long time, and I don't think anyone's ever shown that they have more acne than somebody who is not wearing a mask all day in the hospital. So acne, eczema, I would say psoriasis, but that's one I have to put an asterisk next to because that is kind of like probably the most autoimmune of the list that I'm giving, so may have a smaller role. Allergies, rosacea, hives. Dr. Sarno had hives himself, psychosomatically. Certain types of hair loss. It can increase genetic hair loss. It can cause telogen effluvium. It can increase hair graying. And alopecia areata, where you get little circles of hair loss in the scalp with a beard, and then localized itches. And these could be scalp, somewhere in the back, or genitals, whether it's vulva, scrotum, penis, and sweating being another one as well.
I wanted to ask about one more just because people come to me with all kinds of different things. And of course, I'm a psychologist, so I'm like, I need to gather my information from the MDs of the group to find out. Although I'll say this afterwards, but one of the symptoms I wondered about is, do people come to you sometimes saying their skin has a burning sensation? Sometimes people ask me about that.
Yes. And it's usually scalp, and that we'll call scalp dysesthesia. It's usually an itch or a burn, and it mostly will be older women. There's brachioradial pruritus, itching on the forearms, the top of the arms, and then again, some people it's an itch, some people it's a burn, and of course, then you have the more extreme cases where some people it's a crawl, and then it will go from the neurotic to the psychotic or the psychoses, where of course people think that they have bugs crawling all over them, or there are things coming out of the skin. And that's passed around with psychosomatic. That doesn't fall into the psychosomatic realm, which is neurosis based. That's
right.
That's psychosis.
That's a good, important distinction also. Yeah. Because with psychosis, these things are, I'm sure they're having the sensations, but it is coming from an imagined thing as opposed to an actual physiological event caused by a mind-body
Right.
issue.
And of course, for anyone listening, they say, well, I mean, how maybe new to this game, they might say, well, I can see my hive, I can see my pimple, so of course it's not mind body, it's real. And of course, those of us in the TMS world say, yes, no, we totally believe that. You could see it, you could feel it, I can biopsy it, I could see it under the microscope. It's all real, your pain, your itch, your rash. And it's just a difference of opinion as to what initiated it. And that's where the difference lies.
So I'm going to ask you this is a difficult question, and you are welcome to duck it. You do not have to answer, because I don't even know if there is an answer. But what percentage of dermatological conditions would you say are mind-body?
30%, if I'm going to throw out a number. And if you go back, so if you take back pain as an analogy, and when I lectured a couple of years at the American Academy of Dermatology on this topic, and I used back pain as an example because as a dermatologist, teaching, lecturing to dermatologists, it's hard to criticize your own field. So it's a lot easier when we criticize another field. But,
Right.
in the 50s, when Sarno graduated, they were to have the MRIs, and people knew that back pain was stress induced. And then with the advent of technology, it moved away from that. Well, similar to the skin, if you read the British textbooks of dermatology, again, more so the American textbooks, they're going to tell you that these things that dermatology is 30% mind involved, exacerbated, stress induced, worsened to some degree, and in 1 out of every 3 patients we see. But then again, as technology and science gets better, and we learn about the cytokine, and then we can create a drug that will suppress that cytokine and get your rash better, then again, it moves us away from a mind-body view, which doesn't disprove it by any means.
Right. I mean, that's one of the tricky parts of this is people think that one thing disproves the other, but a lot of times you can't really tell until you're treating it or finding what the results are. It can be hard to say. And I'm sure there are combinations too, where it starts
Yeah,
off, purely physiologically, and then there's a whole response to it.
yeah, and the fight goes both ways because the landmark article by Ader and Cohen published in Science, which was the birth of psychoneuroimmunology, the field of that, where when you gave Cytoxan, a very powerful immunosuppressant cancer drug, to mice, and you along with saccharin, a sweet flavor, you would then lower their white blood cell counts because of the Cytoxan medication, and eventually you would give these mice the saccharin without the Cytoxan, and they would still lower their white blood cell counts. So there was a pure Pavlovian conditions
Wow.
response, and where you could then lower someone's immune system with saccharin, and this was repeated and actually duplicated in humans with cyclosporin.
Right.
So the fight goes both ways, but they're not mutually exclusive, and one doesn't disprove the other.
I'm glad you brought that up though, because on this podcast, different things end up getting highlighted depending on who I'm talking to, and the fact that you could have a conditioned response that can change your physiology and not even be responding to the drug anymore, but now whatever was paired with the drug, that's mind blowing.
Mind blowing. Yeah.
I mean, even for me, who's spent all this time on this, I keep getting my mind blown by this. I'm like, whoa, that's
Yeah.
incredible.
So I know there was a study where they took like patients with lupus nephritis and where the kidneys were infected, and they used this type of training to actually lower the dose of the immunosuppressant.
Unbelievable. I mean, it's so cool. So let me ask you this: when you come in to see when someone comes in to see you, and it turns out that you think they've got a mind body issue, how do you handle that in your practice? Is there something you do in your practice, or is it more just like now it's time to refer to the psychologist and
Right.
you move in that
I
direction?
don't practice, psychology or psychiatry. So it's to get them on the right path, or a different path, or try to open their mind or feel them out. So again, I basically, I'll tell them what I tell them about, a condition, as any good Western dermatologist would do. And then I basically sort of say to them, this conversation is essentially over, but if you're interested, here's another 2 cents. Here's another thought for you. And do you believe the mind and body are connected? Do you believe the mind can initiate physical disease? And again, a lot of people will say yes, and then we can go from there and tell them, I'm trained in the West, but I really believe that there's a very strong connection of mind and body. And the good news is that you don't necessarily have to get rid of stress to get rid of a stress-induced problem. You just have to be aware of that, because getting rid of stress is not practical, and stress can be
Right.
good for you. But and I'll give a million different examples to what's might be related to the patient or not. And talk about the Buddhists who can meditate and lower their heart rate and their blood pressure and their pulse, or their walk on hot coals, or not eat for a week because their mind controls the body. So many examples to give. And and sometimes they might come in for a splinter, and I see they have back pain, and I might tell them about Sarno for that, and then I'll refer them to Dr. Rashbaum. But at least some of the orthopedic literature is a little bit more black and white. But New England Journal of Medicine 2001 has a beautiful study that arthroscopic surgery on the knee does no better than placebo in the New
Right.
England Journal of Medicine against fake sham surgery. It's a beautiful study in the New England Journal of Medicine.
You know what I think is interesting is all these studies, one of the things they all have in common is the placebo effect is in there. And people aren't talking about the fact that that's a piece of information. That's a piece of data. They just treat it as a novelty act. Like, yeah, we compare it to the novelty act, the placebo effect. But the reality is the placebo effect shows that there's a mind-body effect in every study we do.
Yeah, and and when it comes to topical acne medicine, they use such an incredible number of subjects because they know they have to beat that placebo effect. And so, how do you manipulate the study? You have a very large N. But when you look at the placebo rate in any topical acne medicine is about 40% effective. And some of it is, and some people say, walking into a doctor's office is a placebo effect because so many times a day, I have this terrible rash, terrible acne, terrible itching, and it just got better. It just got better. It got better in like the last 12 hours. It just got better. To any statistical phenomenon you could explain other than it's its own therapeutic placebo effect.
Have you found that that things are changing? Like when you think about, let's say 10 years ago, in the last 10 years, I've seen some things changing, but it's hard to know in what corners. And I'm just curious what your take is on kind of the state of the mind-body field, I guess we would call it. It's pretty sprawling, but what do you think about that?
I think it's changing, but it's glacial. And I think it's a little bit hard for me to judge, to be honest, because first of all, I'm in one of the meccas of psychotherapy. I could throw a rock and hit Dr. Sarno's office.
Yep.
I've got 20 PhDs trained in psychoanalytics that I could refer to, within a mile of me. So it's a little hard for me to judge. So I definitely see a little bit of progress here and there, but I'm not incredibly overwhelmed.
Well, and I think it is hard to know anyway. We're gonna get to a tipping point at some point. I think very optimistically, but I think that, and this is one of the reasons I do this podcast, is if we keep talking about it with more people, then more people have been exposed to it enough that they're more familiar when they get there. Yeah. and have that conversation.
It's going to happen before the next ice age for sure.
Before the next ice age, we have a cockeyed optimist on our hands. But look, it is important to have some realism about it too. There's been a lot of resistance to it. I'm sure you saw all the rage. You watch what Sarno went through.
I was in all the rage. Yeah,
that's right. I forgot that.
My 45 seconds of fame.
Yes. Yeah. You not only watched it, you lived it.
Right, and that's what I was going to say about bringing it up to patients or bringing it up to like Sarno always said, like he was invited to like some 500 top 500 corporation to go lecture. It wouldn't go well because they were not seeking him. People who seeked him out understood, but to just lay this on an unknown audience, it doesn't sit. So you have to know your target. You got to pick and choose, and sometimes you just gotta wait till they are desperate and come to you, hopefully instead of somebody else.
Do you ever find that patients come to you? I don't know if this will happen very often, but I'm sure it has happened sometimes. Do patients sometimes come to you certain that something is psychosomatic that isn't?
Not too often. Because
it's usually going to cut the other way.
Nobody really walks in thinking they're cancer psychosomatic. So no,
it doesn't usually happen.
There might be a case here or there, but not too often. Also, I think a lot of the patients who really think their rash is psychosomatic don't come in.
True.
Like a lot of people, people who are enlightened, just like if you have knee pain and you believe in Sarno, you might get that MRI just to know there's no tumor in your knee. But once they tell you, oh, you have a little meniscus tear, or arthritis, you're like, okay, doc, see ya. That's all I needed to know. So, so some of those patients may not even come in.
Yeah, it's That's a really good point. A lot of time, the cross section of people that are going to come in is going to be very different, whether they are believing in these things or not. But I do think that I think things have changed a lot, at least in terms of exposure. But I don't know. Sometimes I wonder if I'm too close to this myself, because 10 years ago, I discovered Sarno in 2011, and not a single person in my life mentioned him to me until then. Later I heard, oh, if you had been listening to Howard Stern, you would have heard about this. Like that's
Right.
the way Howard Stern is the gateway drug.
Right. That's right. Well said.
But I couldn't believe that nobody knew about these things. And now I want, it's hard for me to know. Do you think more people know about either Sarno or about mind body work in general? I mean, I find
Yes.
it's certainly true, but
Yes, and it comes from different angles. It comes from Michael Phelps advertising for an app about psychotherapy. That's
yep.
great. It comes from, the British royal family talking about, depression. So when people talk about mental health, and that's helpful. But again, Sarno, in our little world, reinvented this, or rediscovered, I should say, in 1970. But this is, again, this is a Buddhist concept. This is not a 100-year-old concept. It's a couple thousand years old, and it really regressed significantly, and so we're just baby steps back.
That is an important point that I try to make all the time, though, which is this is not new. If you read Plato or Socrates, or you look into ancient Chinese culture, or Ayurvedic medicine in Africa, or even Native American culture, it's everywhere, and people just didn't know that. So then I wanted to ask you about. I'm wondering about. Do you train people in what you do? And part of the reason I ask is that I feel like I know that I'm gonna feel a personal responsibility to train people in what I do, because we're gonna need to pass this down.
Well, I used to say, like, when I had my back pain, I would think to myself, if there's somebody out there who can cure this pain, I would give them $100,000. It started at 10,000 and eventually went up and up and up. And of course, that person turned out to be Sarno. And so my payback is to telepatients and patient after patient. I mean, I probably bought about 200 copies of his books to give to patients that have directly or just taken from my exam rooms or whatnot, and mail to friends, with this diagnosis or that. So I was fortunate that when Sarno, after a while of doing his two classes, one on Monday and Tuesday with some students, decided to open them up to panels. So we had 4 patients on a Monday night, and he had 100 people in the auditorium at NYU. And so I would speak on those panels as a patient, because the patients like to see a doctor there. And again, I've lectured a couple times at the American Academy of Dermatology meeting and a couple other places. And I teach residents. So we have the NYU residents, 8 a year, and they hear these stories over and over again. They hear this lecture. So hopefully it's sunk in. It's a couple conferences, and
Well, I'm glad to hear
listen.
it. Because I think for every Roy Seidenberg, there needs to be at least 8 more that come out and go into the world, because we need doctors like you. This is one of the reasons that I have people like you on the show. It was incredibly important to me that Dr. Sarno was an MD. If I had just read a book I'm a psychologist, so I'm not telling people, hey, if you read my book, which was going to come out soon, oh, you've got to go to a medical doctor. But I do rely on the doctors to rule things out first, because I have to. We gotta treat things medically first to be safe. But it also it really helps hammer it home if medicine and psychology are kind of in this together and thinking about it together.
And Sarno, of course, really did, relatively speaking, really did shun away from the press and publicity. I mean, there are patients who would have, put him put a billboard on the moon for him.
Yep.
And unfortunately, I'm not very prolific, so I don't have any book out, and I'm not a big user of social media. But whoever wants to hear it, I'll burden them with a lecture.
That sounds good. Well, Roy, I want to thank you for coming on here. It's a pleasure to connect with you. I think you're a great asset to the field.
And if I can say one thing, I just want to mention,
please
there
do.
is a lot. There's a lot of scientific literature. So I don't want people out there to think, it's all hocus pocus. Yes, there are journals called psychosomatic medicine, but this is published in real Western, serious taken medical journals that just most doctors tend to ignore. The literature is there.
And I think some of it is because somehow the science isn't getting to the med schools in that way. And then it's not getting, passed down. But as a community, I think we're a very grateful bunch because it's like you said. I mean, we would have paid huge amounts of money for anybody who, or followed them to the ends of the earth if they could do this. And Sarno could do it, And now there are others doing that, and you're doing that. I'm doing that, and we're spreading the word. And but I appreciate your contributions, and I want to thank you again for coming on.
Thank you, Dan, and always a pleasure working with you. Thanks so much.
All right, Roy. Talk to you soon. It's always a pleasure to kind of add another key member of the mind-body world to this kind of podcast library, and I felt that Roy Seidenberg was very important to have on. Anytime there's someone who has, he's very good at what he does, but also somebody who has a specialty within this world. I mean, literally, when I think of somebody saying they have some kind of psychosomatic rash, I'm like, boom, I can go straight to Roy Seidenberg to check this out. And it's MDs like him that make my job a lot easier because they're the ones who can kind of clear people of any medical condition and bring them to me, and I can treat without worrying too much about it. Now, if people have been to see multiple MDs, I tend to trust that as well. But if there's somebody with a rash and they go to Roy, I know that he's going to be able to help me see what's coming from what. And so it's the joining of medicine and psychology and us meeting in the middle to figure out a path for the patients that really is helpful. And I am very appreciative of him and very glad that he is training people as well. I think it's so important that all of us who know these things in our given fields do pass that on, because we really do have to get this dialogue changed. And the only way to do that is to make sure that the next generation is on board with this. So if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I will get back to you personally.